So hi everyone. Nice to meet you all virtually. And today my presentation is about how to combat insomnia using some methods that we use in what's called cognitive behavioral therapy for insomnia. And I'll talk about this a little more later, but basically this is a very structured therapy session that people use to help others with insomnia. However, today will not be a formal therapy session, but I will be pointing out certain useful strategies that you can use in day-to-day life to try to improve your sleep overall. So the objectives of this talk is that afterwards, you will hopefully have an overview of factors driving sleep and insomnia. You'll gain an understanding of cognitive behavioral therapy for insomnia, and hopefully walk away with some practical tips to combat insomnia. So there are two really important processes that drive your sleep overall. So the first is how sleepy you are, and then secondly is the circadian rhythm of your body. So what drives how sleepy you are is what's called sleep pressure. And I want you to think of this as sort of your bank account for how much sleep you have. The longer you are awake, the more sleep debt that you collect. And then the more debt that you connect, that the more physical and cognitive deficits you end up occurring. So it's almost like you're paying interest because you're borrowing wakefulness from the future. And when you pay it back, interestingly, it's not always hour by hour. It's like if you miss 5 hours of sleep, sometimes it doesn't take 5 hours to get back. If you can get a very sound sleep, you can maybe just sleep for 3 good quality hours. Or sometimes you need more to pay it back. And external factors that appear to reduce sleep debt, which are things that try to keep you awake, like caffeine or amphetamines, will only temporarily mask the debt. So it's almost like you're not looking at your bank account rather than you're actually repaying into it. So things that affect sleep pressure, the things that increase it are things like staying up late for sleep. If you have an infection, you tend to feel more tired. If you have really intense emotional experiences, you can feel more tired afterwards. And then if you exercise a lot, you can feel more tired. Things that decreases it are things like good sleep, taking naps, but again, temporarily. And it might actually shift your sleep cycle. And also caffeine, for example, can mask the sleep debt temporarily. The other process driving it is the circadian rhythm. So interestingly, in your body, the neurons all have its own internal clock. And the cycle is usually a bit longer than 24 hours, which is our day-to-day cycle. But because of external cues, the neurons work together in your body and the external cue synchronizes it so that they sort of follow the same cycle. So the things that can affect the circadian rhythm include things like sunlight, darkness, which promotes a hormone called melatonin release that helps with sleepiness. Exercise, food, jobs such as shift work can sort of shift your circadian rhythm, and your social demands, like if you're going out clubbing at night. And what drives your sleepiness is really this competing process of how sleepy you are and the circadian rhythm of your body. So if you look at this graph, during the day, theoretically or ideally, your sleepiness is actually very low, and then it slowly accumulates throughout the day. And your circadian rhythm, it keeps you awake during the day. And then it slowly sort of drives your sleepiness throughout the night. So ideally, if these two things coincide, you would be alert during the morning and then you would be sleepy at night. Then once you sleep, you become alert again during the day. However, because of the things we talked about, sometimes the circadian rhythm can shift, sometimes your sleepiness can shift. So then you end up either not feeling sleepy at night or feeling too tired during the day. So insomnia, in short, it's basically a sleep disorder characterized by difficulty falling asleep, staying asleep, or both. And I think some of us can relate to this, where during the day you feel extremely sleepy, and then suddenly at 3 a.m. you're wide awake. And it can be quite distressing. So cognitive behavioral therapy is is a type of therapy we use in psychiatry in general. So how it works is when there's a situation, the idea is that the situation will trigger certain thoughts, either positive or negative, and the thoughts will lead to your emotions that are associated with the thought, and the emotions will drive certain behaviors around it. So the problem is if you have negative thoughts that are triggered, it will lead to negative emotions and maladaptive behaviors. So one example is if you're really afraid of social situations, you will have and then you're invited to a party. You may have thoughts like, people won't like me, I'll be embarrassed, and that triggers emotions of like fear, shame, anxiety, and the behavior is that you may end up not going to the party, which may actually reinforce these negative thoughts like, now that I don't go, people are going to judge me. Then you feel more anxiety and you avoid more, and it becomes this negative cycle. But interestingly, improving any element of this triangle, such as improving the behavior, improving your emotions, or improving your thoughts, can actually improve the whole cycle and lead to an overall improvement in the quality of life. So now I'm going to talk about how this applies to sleep. So for example, someone can't sleep. Then their thoughts become lying in bed, thinking, ruminating about all the things that went wrong, and then feeling a lot of anxiety, perhaps related to the sleep difficulties or just of all those negative thoughts that came up. And then there's also behaviors that may drive the cycle, such as staying in bed on your phone for a long time, or being overly excited before bed. And all these things can lead to worsening of your sleep cycle. And cognitive behavioral therapy for insomnia has these 6 elements. It's actually one of the first-line treatments for insomnia. And it usually occurs over 6 sessions, about 1 hour each. And the different elements include, you start off with writing a sleep diary where you start to chart your sleep and your sleep behaviors around that. You practice what's called sleep hygiene. There's something called stimulus control. So controlling the like what you do before bed or how you behave in bed. There's something that's called sleep restriction, which is really trying to set a routine pattern in bed. Relaxation training, and then cognitive restructuring, which helps with those thoughts. And how these elements fit into the cognitive model is the cognitive restructuring helps with the negative thoughts around sleep. The relaxation can combat these negative emotions like anxiety. And then the behavior piece is actually quite significant. So 3 of these actually affect the behavior. So you try to you try to do sleep hygiene, you control the stimulus while you're in bed, and then you also try to set a good sleep pattern. All right. And before we go into all of that, the most important thing to improve your sleep is actually motivation. And motivation is a huge piece before starting any sort of therapy. And some things to ask yourself before you even dive into this is, what's the benefit of you staying up? How is insomnia affecting your life? What goals do you have for your sleep? And if I slept better, what are things I can accomplish? And hopefully this will help yourself set a framework and increase your motivation a bit if you can see insomnia has certain negative parts, negative effects on your life. Or if you slept better, you can have certain goals and potentials that you want to achieve. So this is the sleep diary. You start off, the first part of CBT for insomnia is actually you basically document your sleep and answer these questions. So this is how a sleep diary of the week looks like. You record when you go to sleep, what time did you try to go to sleep, when did you fall asleep, how many times did you wake up during the night, how long did these awakenings last, what time was your final awakening, what time did you get out of bed to start your day, and anything that interfered with your sleep. And one important thing to know is that there's a lot of times here. However, sometimes it can be really anxiety provoking or even counterproductive to stare at the clock and count the minutes. So what we usually recommend is, if you can see the clock, that's fine, but we don't actually recommend you looking at the clock constantly. So a lot of these times can be estimated if possible. It's just a subjective feeling of, how long were you awake? How long did you wake up for? And then the next piece is stimulus control. Now, before we get into that, I just have some true or false questions that I wanted to ask you all. And you don't have to answer, you can just kind of think about it in your head. So the first one is a warm bath before bed will help with relaxation and sleep. So the answer is actually false. When you take a warm bath, I think it's often seen in movies or media that it can help you relax. However, it can actually drive up your body temperature, it can stimulate your body, making it harder for you to fall asleep. It's better to lie on the couch until you're very tired before going to bed. So this is actually true. And I'll explain a little bit about that later, but what we really want with stimulus control is to associate your bed and your bedroom with sleep. And that means falling asleep right away, not staying in bed, rolling around, having anxious thoughts. So if you do have those issues, we actually recommend you do those in a different location until you're so tired that you will want to go back to bed. And that you will go back to bed and basically fall asleep right away. This will teach your brain to associate your bed with falling asleep quickly. Okay. So it's better to exercise before bed than in the morning to tire yourself out. So this is actually false. I know before I mentioned that exercise can actually build up sleep debt. However, it can, if you do it earlier in the day, at the same time, if you do it later in the day, there's a competing interest. It does tire you out, but again, it raises your heart rate, it puts your body in this sort of state of stress. So if you do it right before bed, it can actually keep you more awake. So stimulus control, the don'ts and the do insteads. So if you feel that you're lying awake in bed for over 15 minutes, again, this is hopefully a subjective feeling without you watching the clock, the recommendation is for you to actually get up and go sit or recline in another room while you do something relaxing or boring. And the reason I bolded that is not only do you want to sort of remove yourself from the bedroom, but you also want to sort of distract your mind too, or else you're going to keep focusing on, I'm just here because I can't sleep, and sort of ruminate over that. And don't do any activities in your bed other than sleep or sex. So this is what I mentioned before. Instead, you can lie down only when you're extremely tired and can fall asleep almost right away. And third, don't expose yourself to too much excitement before bed. So things like watching a riveting drama, exercising, smoking, warm baths, or get into arguments with your partner right before bed. It is good to not go to bed angry. At the same time, hopefully, if you can work out your problems a little earlier, that can help with the sleep too. Instead, do some winding down, things like soothing music, reading a textbook that can sort of turn your brain off, and deep breathing exercises. And start maybe about an hour before bed. So the next one is sleep restriction. And I put this here because this is the one that takes the most willpower, almost like this ice climber. Because what it requires you to do is actually to wake up around the same time every day, regardless of how much sleep you've got throughout the night and regardless of when you fall asleep. So how to do this is you should make an estimate, especially based on your sleep diary, of the reasonable amount of time, amount of sleep that you get when you go to bed and when you wake up. And then you pick a time in the morning that's reasonable for you, like when you have to get out of bed to go to work or when your routine starts. And then subtract that many hours. So just pick that time and hopefully go to bed always around the time when so that you can get that much time in bed, but always wake up around the same amount of time. So even if you go to bed at 11, for example, and you have to get up at 7, but it takes you 2 hours to fall asleep, still try to get up at 7. And this is really difficult because you might be really tired and you want to sleep in. However, especially on things like weekends, where there's no pressure to get you up. But again, you want to do this to first train your body to get a regular rhythm. And also you collect a bit of sleep debt. So hopefully the next day, when you go to bed at 11, you can fall asleep quicker. The other thing is do not nap during the day, because when you nap, you're almost paying back that sleep debt a little early, and you might actually accrue more wakefulness for the night. Unless, of course, it poses safety risks, like if you are too sleepy to drive or operate machinery. And try to do this for 2 weeks to start. And what this does is, if we go back to the original graph, we actually, for example, if you are really sleepy, even way past 11, then you wake up around 7, but you still feel this much sleepiness, then you push that sleep debt to the next day so that hopefully you can fall asleep easier. And the next piece is sleep hygiene. So this is probably a buzzword that's sort of been flying around quite a bit, but again, it's a lot of things that are healthy to do or unhealthy to do before bed. So the things to not do are things like eating heavy food, drink alcohol or smoke before bed, training really hard before bed. The blue light on your phone, especially when it's really close to your face, can actually reduce the melatonin, which is the sort of sleepiness hormone in your brain, and keep you awake. Drinking caffeine, and of course, stress and anxiety. The things that are good to do are, so again, getting up at the same time, like the sleep restriction that we talked about, having a comfortable bed environment, having a bedtime routine to train your body to start to feel sleepy when you're doing those things. Evening walks are okay, as if they're, really relaxing and slow. Keep your room a bit cooler, darker, and then I would just take out the relaxing bath here because we mentioned that warm baths are not always good. I guess one important thing I just wanted to talk about is caffeine, because a lot of people have questions about this. So caffeine is what's called an adenosine receptor blocker, and adenosine helps with things like sleepiness, wakefulness throughout the day. And it we recommend limiting caffeine to at least 6 hours before bedtime. And it's shown that if you drink it too close to bedtime, it can actually reduce what's called slow wave sleep, which is the restful part of your sleep. And the Food and Drug Administration recommends the daily maximum caffeine intake to 400 milligrams. And just down here, I put some references as to how much caffeine there are. So decaf coffee, as much as it's called decaf, actually still has a tiny bit of caffeine. So does hot chocolate. And interestingly, black tea has almost, close to half of the caffeine that coffee has. So I think a lot of people think tea has a lot less caffeine, so they would drink that before bed, but black tea actually has quite a bit of caffeine. And so does Coke, which has similar caffeine content to black tea. And the other question people ask is, what if I often get up to use the washroom? And this could be due to a lot of medical reasons too. But the lowest hanging fruit to address is how much fluids you drink before bed. And the usual recommendation is to stop drinking fluids 2 hours before bed. And the reason for that is, if you look at this chart for adult bladder capacity, the estimated time to pee after drinking water is actually about 2 hours to 2 hours and 15 minutes. So we don't want you to have to interrupt your sleep because your bladder is full. Okay, and the most important thing to practicing sleep hygiene is consistency. So if you practice it once every week and then the rest of the week do what's normally done, it doesn't actually train your body to learn to associate these cues with sleep. So it's important to continue, maybe pick one or two and continue doing them every single day. So the next one is relaxation training. The few that we actually talk about are diaphragmatic breathing, progressive muscle relaxation, and mental imagery. So diaphragmatic breathing is really, you guys can do it with me. Basically, breathe in and really try to fill your lungs to the capacity. And hold it for a few seconds and then breathe out. And then just continue doing that slowly. And when you breathe slowly, it triggers your parasympathetic system, which is the relaxation nervous system, to start to relax the other parts of your body too. And well, progressive muscle relaxation is trying to find a group of muscles on both sides. So I would maybe, let's say, your hand, your wrist, your elbow, and your shoulders, and clench them all at once, really, really tightly for about 5 to 10 seconds. Then after that, relax them all at once. And what this does is, the idea is that you're almost fatiguing the muscle. And then when you relax, it actually puts the muscle in this extra level of relaxation versus generally your muscle is in this sort of semi-state of contraction. And then mental imagery, this is totally up to you what you find is relaxing. But to basically close your eyes and picture a very relaxing scenario. And then I don't know if the chat is working, but it'd be interesting if everyone can brainstorm on what are other things that are really relaxing for you before bed, just so that you can share the experience. Okay. And then lastly, the piece is called, oh, okay, classical music is one. Chamomile tea, yes, but hopefully not 2 hours before bed, or maybe just smelling it. Yeah, thank you. All right, so cognitive restructuring. This is the last piece of the cognitive behavioral therapy for insomnia. And this is usually sort of the picture of someone who has a lot of anxious thoughts before sleep. And sometimes the thoughts are related to the sleep itself. So people will think, like, what if I never fall asleep? They start to catastrophize. Tomorrow will be a waste because I'm too tired. I'm going to fail my exam. I'm never going to find a solution. This is ruining my life. And you can see how the more you think about that, the more awake you feel and the more anxious you feel. And in addition to that, you can start to ruminate on all the embarrassing moments that's happened to you or random questions about the world. And then that keeps you awake. So cognitive restructuring is really good for people who have a lot of these thoughts and that keep them awake at night. So there's this interesting technique you can use called paradoxical inference, where you basically you roll with the resistance of the anxious thoughts. And oh, sorry, I think it's called paradoxical intent, not inference. I'll change that. You basically roll with the resistance of your anxious thoughts. So let it come. Let me think of more things that are making me anxious. What else? What else could go wrong? Kind of challenge yourself, almost make it into a game. Because the more you roll with the resistance, it's almost like don't think of a white elephant. You're almost making yourself like not think of those things. If and then the other thing is some people try way too hard to try to sleep. So they lie down, they like really try to close their eyes and tell themselves like, I need to sleep, let's try to sleep. And that sleep effort actually goes against you falling asleep. So in a way, less is more. And you almost try to kind of give yourself this freedom of like, well, let's just try to stay awake. Let's see, I don't need to go to sleep, it's fine. And once that pressure is lifted, interestingly, you actually relax more and you fall asleep more easily. The other thing is to think of wakefulness as an opportunity rather than a disaster, because a lot of people start to worry like, this is the worst thing, like being awake is so dreadful. What am I going to do? again, try to let go of that worry and see it as an opportunity. Get up, try to do something fun or productive with the time, so that you don't end up associating being awake with all these fear thoughts. And this is a weekend challenge that some of you can try, which is basically to try to stay awake as long as you can while having fun and try not to sleep until you absolutely cannot stay awake, and see what happens. Okay. All right. So thank you, everyone.